A healthy society is a productive society, which is very important to a healthy economy. So the business community not only wants to keep their employees healthy, they want to have a healthy environment in the state of Rhode Island. So we came up with about 6 issues, 3 that we could say we'd like to see legislation that would go through this year. But let me start with the first issue that we think is important, is the issue of continuation of benefits known as COBRA. What a lot of businesses don't understand is that if you have an employee that leaves your employ and takes COBRA, and all of a sudden either can't afford to continue that or can't afford to continue it, or other life-changing events happen, they do not have the right to move over to the individual part of the exchange until they are eligible, which I believe happens at the beginning of the year. So if someone takes COBRA and all of a sudden they can't stay on COBRA, they go without coverage for a period of time until they're eligible to join the exchange. We need some type of notification or something similar to what the federal has, and they have a statement that goes to the employees to let them know that it's important that they make a very educated choice on how they're going to continue their health care. Another issue that came up is individual mandates or other legislation concerning health care. We'd like to see something from a perspective where there's a review process that goes in place, and any legislation mandate or any legislative bill that affects health care in any format that could be a cost to an employer that goes through a review by OHIC, or it's reviewed under OHIC. So we'd like to see a review of that also. We also would like to see some incentives to the employer that they can to promote healthy lifestyles for their employees in some format, whether it be through reduced costs of the health care plans or something of that nature. So these are the global issues that we'd like to work on, and maybe we can formulate some type of plan there. The real issues are 3 that we really came up with that we really think should be addressed this year is Medicare for someone that turns age 65. So if an employee turns age 65 and they want to go on Medicare, it's a little bit different when if the group is under 20 versus over 20, but from the groups that are under 20, the employer can get a Medicare supplement for them and provide that supplement, which will reduce the cost of the health care for the employee and the employer. However, the employee's dependents are no longer eligible to stay on the company plan or the group plan. So then they have to go and find something for them for insurance purposes. We would like to see some form of legislation that would treat the dependents of an employee who turns age 65 and goes on Medicare as an employee of the company and give them the opportunity to stay on the health care plan at the discretion of the employer. That's a first ask. Secondly, surprise billing and facility fees. We're really concerned about this. How many of you have gotten a bill in the mail because you had some procedure and said, okay, yep, you're covered except for there's a fee for the facility that's $200–400. That's something else that or surprise billing where you have a procedure at a major hospital and all of a sudden you get a bill from one of the physicians that was part of the surgery, let's say, and all of a sudden one of the physicians in the surgery sends a bill to you because they are no longer part of the network. We really need to address those, and it's nationwide, but if we could do something in the state of Rhode Island, I think that would be very important to everybody in Rhode Island and the business community. And lastly, which we got halfway there last year, and I'd like to thank the speaker for his support on the H6062, which is a sole prop waiver. That passed the House virtually unanimously. We need to get that done again this year, get it through the House and get it through the Senate. That would give the Healthcare Commissioner and the Health Source Rhode Island the ability to apply for a waiver allowing sole props to purchase group health care. So anybody that's a sole prop that either is individually employed or has their own business, does not have any employees, even if their employees are family members, they do not count as employees, they have to purchase in the individual marketplace. We'd like to give them the opportunity to do that in the group marketplace, And there are a couple of reasons. Number one is if you look at it from a perspective of taxable, again, you can get into the tax part of it. If you're buying it as a business, it's a different taxable event as if you're buying it as an employee. But the other part, but the other part that I think is important is the fact that if you do hire somebody and you go and get group insurance for that individual, and there's two of you now working, and all of a sudden, for some reason, maybe that person goes on their spouse's house plan because they got married that month, you all of a sudden have to go look for insurance again in the individual market and start the process all over again. So that gets kind of overwhelming from that perspective. So those are our asks for this year, and we appreciate the opportunity to present these. And again, thank you all for being here. We appreciate you coming to this great event. Thank you.